I am right now on my way from Iowa to Scotland, and I decided to stop here and talk about my summer projects, as I like to refer to them. But of course, they are not really my summer projects. They are a teamwork with several different collaborators that I'm working with, and I'm very grateful that I have all these collaborators on these studies that I'm going to introduce to you. I worked with people from Iowa State, people from Virginia Tech, and also from the University of Cincinnati. I'm going to talk to experimental vaccine approach. As we know, vaccines in pigs are really important. They are increasingly used, and in times where we are facing antibiotic resistance and removal of antimicrobials, we need to improve that and get more and more vaccines established for pigs. In this particular presentation, I'm going to focus on a vaccine for PRRS and an experimental vaccine for PRRS that is based on the SAFE concept. That is a collaboration with Virginia Tech, Dr. Ming and his group. If time allows, I will also talk a little bit about the P-particle vaccine, which could be a universal vaccine approach for Influenza A virus. That is a collaboration with Cincinnati Children's Hospital and Iowa State University. And finally, I also did a heterologous live virus exposure with PEDV, which resulted in interesting results. And if time allows, I will introduce that one. Starting with the SAFE approach, SAFE stands for Synthetic Attenuated Virus Engineering and has been first introduced in 2008 in a science paper by Coleman and his group. The SAFE approach basically uses a computer algorithm, and an amino acid is recoded to change the codon pair bias. The codon bias is the actual encoding of amino acids, and the codon pair bias means that some synonymous codon pairs are used more or less frequently than expected. If you look at these, if you look here, if I can get to work, so if you look at these two amino acids, alanine and glutamine acid, they can be encoded by two different nucleic acid patterns. It does not matter if you look at the upper one or on the lower one, they all end in the same amino acids. But if you compare them, there is a bias towards GCA, GAG, that is 7-fold more often used than the other version. And Coleman and his group thought if we could change, there must be a reason for this, because potentially the version that is used more often is more stable. So if we could change that, that could result in a virus attenuation. And the SAFE approach has the advantages that you do not change the amino acids, you are just changing the nucleic acids, which means you still have the same codon bias, and this also implies that any attenuation is not subjected to reverting back, because you're introducing so many different mutations, it would be impossible for the virus to revert back. And it's also very rapid. In our example, so you're just going from this amino acid combination to this amino acid combination by changing here the C to A and by changing here the A to G. So then here, this slide here shows you the swine codon pair bias. If you look at a swine genome, you see that codon pair bias that ranges in the ideal range from minus 0.1 to 0.2 with a peak here at 0.1. And the idea in virus attenuation is if you optimize the viruses outside that range in that area and in that area, then they will be less stable and you have an attenuated virus. The process step for PRRS, you must envision it like that. First, you need the PRRS strain that you have on farm, so you need to isolate it. That takes about 3 to 7 days. Then you have to sequence the open reading from 5 gene, which takes a couple of days. then you require to have access to that computer-based codon pair de-optimization. That takes about 1 day to run the open reading frame 5 through that computer program. And then you need to genetic modify the farm-specific per strain, confirm the sequence by sequencing, and then you can culture the modified strain, and potentially you have that virus ready in about 2 to 6 to 8 weeks, which is really quick. So we tried that on the example of VR2385, which is a PRRS virus that we are using rather often. It's well characterized in the pig model. And when we ran that VR2385 sequence through the computer, 2 different viruses were generated. And one of them we called SAFE5, the other one is SAFE7, which I will show you on the other slides. But just looking at this here, compared to VR2385, in GB5 there are 78 silent mutations introduced, and in NSP9 there are 459 silent mutations introduced. So there is no way that the virus can revert back to its original form in a very short time period, if ever. So then the virus, the rescued vaccine viruses were compared first in vitro to see if they have similar growth probabilities compared to the original strain. Here you're looking at VR2385, and you can see that the SAFE5 looks very similar. It was able to infect MAC145 cells, and also the SAFE9 looked very similar. Then the in vitro expression of viral proteins was checked. Here you're looking at the VR2385, has very strong and very visible genes. The genes are still present here in the other viruses, but they are a little bit weaker. Then here you are looking at growth kinetics in PK15 cells and CD163 cells. The VR2385 grows very, very well. In contrast to that strain, both SAF5 and SAF9 have a reduction after 72 hours post-infection. So finally, the next step was to test the viruses in pigs. Can they infect pigs? Do they produce antibodies? Do they produce any lesions? So that was the safety testing in pigs. And here we are looking at RNA copy numbers in serum at 7 dpi, at 14 dpi, and then here also RNA copy numbers in lungs at 14 dpi. VR2385 has around 10 to the 8 genomic copies in serum. SAFE5, a significant reduction. SAFE9 did not replicate in the pigs, so that is one of the downsides of that attenuation, that you easily can over-attenuate a virus, and that probably happened to SAFE9. But SAFE5 was attenuated but still replicated. 14 dpi, basically the same picture as at 7 dpi. There was a significant reduction in virus numbers in serum, and the same in lungs. There was a significant reduction in number of copies in lungs. And here we are looking at infectious virus titers in serum samples. Lung lesions here, VR2385 induced around 40% macroscopic lung lesions, and that was significantly reduced with the vaccine virus. The same with the microscopic lung lesions, there was a significant reduction. So overall, these preliminary studies in pigs looked rather good. It looked like the virus was attenuated. It looked like it could still replicate in the pigs. This was the first example of a veterinary virus for which the SAFE virus approach was used. And the PRRS with the codon pair de-optimized GP5 was successfully rescued, and that is an implication for rapid vaccine development if needed, at least for the PRRS, which example we tried here. So the next step to prove the concept was to test that vaccine virus in pigs in a challenge model. So the objective was to assess the immunogenicity and protective efficacy of CA5 in decreasing clinical signs and viremia associated with VR2385 challenge in a conventional pig model. For that project, we used 5 groups of pigs. We had 9 to 20 pigs in each group. And the pigs were vaccinated at 3 weeks of age. They were either sham vaccinated with saline, or they received the CA5 either intramuscular or intranasal. The dose that we gave was 3 milliliter at 10 to the 4/5 TCID50, and we gave the same dose intramuscular and also intranasally. Then, at 9 weeks of age, the pigs were challenged with VR2385. That was 42 days post-vaccination, which is normally done in vaccine challenge studies. And for the challenge, we used 2 milliliter of the VR2385 at a dose of 10 to the 6.6 intranasally. And necropsy was done 12 days after challenge. So here you are looking at the serology response in the pigs, and I omitted the original slide. The original slide was rather confusing. I divided here the vaccinated pigs into 2 groups. I divided them into pigs that were antibody positive at the day of challenge, which was day 42, so that is the VAC positive D42 group, and then pigs that were negative at the time of vaccination, had no evidence of any antibody response at day 42. As you can see here, out of 30 pigs, only 10 pigs had a serological response at the time of challenge, whereas 20 pigs were negative. If you look at how many pigs were positive based on route, we had 4 pigs that were intramuscular vaccinated that were positive. We had 6 out of 10 from the intranasal group. It looked like the intranasal group worked much better than the intramuscular group for that particular study. But again, I need to point out that 2/3 of the pigs did not seroconvert. And after challenge, the pigs that had not seroconverted, that is the black line, they seroconverted after challenge and were positive by the end of the study. This slide here gives you the PCR levels in these pigs in serum at different days post-vaccination and also then post-challenge. The challenge was at 42 days post-vaccination. The blue group is again the group that was positive, that was antibody positive at the time of challenge. These were the only pigs, the only vaccinated pigs that had an active PRRS replication, a detectable PRRS replication. We sequenced the virus in all of the pigs and in all samples, and before challenge, we found only CA5 virus. After challenge, in these 2 groups, we found only VR2385 virus. In these blue bars, this would be the VAC D42 positive pigs. We found a mixture of CA5 and VR2385. There were 2 pigs that were co-infected, but most of the pigs in this group were negative, and hence, therefore, we have very low levels of viremia in this group. So what you can see here, that these vaccinated pigs that developed antibodies, they replicated the virus, and then they were clearly protected after challenge. And then we also looked at macroscopic lung lesions and interstitial pneumonia and antigen in these animals. And we had a similar trend as on the previous slide. When you compare to the positive control had about 27% in average gross lung lesions. The vaccinated pigs that seroconverted had 4.2. That was a significant reduction. The other group, the group that did not seroconvert, had 15.1, was also reduced, but still much higher than the pigs that had seroconverted. In microscopic interstitial pneumonia, we again saw a significant reduction, and also there was a significant reduction of PRRS antigen in these pigs. So the results indicate that a safe approach can be effectively used to attenuate a PRRS strain. Additional work needs to be done to further improve the CA5 vaccine efficacy. We are not vaccine manufacturers, so we may have done something wrong with the dose, how to vaccinate these pigs. You also need to consider that in our trials we only have a low number of pigs available, so we had 8 to 20 pigs in each group. That is not really high. So additional work in that regard needs to be done. And then, this work shows that we have the ability to utilize the safe technology to rapidly produce a vaccine strain that is customized for a specific PRRS strain that may circulate on the farm. And this is a very practical approach and could have a major impact on reducing the major economic losses associated in PRRS where vaccines are not working. If you have any more questions on that, that paper just recently has been published, and maybe that can answer any questions that you still have. The implications of that are that the CA5 approach requires significantly less time compared to the traditional cell culture attenuation, because if you cell culture attenuate a PRRS, you need to passages, I don't know, at least 50 times or so, or even longer, so that takes several months. With that approach, you can attenuate the virus without altering the antigenicity of the virus protein, and that is very important. So you still have the same virus. When you traditionally inactivate a virus, you have a change of amino acids as well. So the protein sequence is identical to the wild-type PRRS, and that is probably the main advantage of that method. The potential drawback, as you have seen in the study, is an over-attenuation, which may affect the ability of the virus to replicate in the host. Okay, with that I would like to move to my next study, and that deals with Influenza A virus. As we know, Influenza A virus, similar to PRRS virus, is difficult to control by vaccines. While we do have several vaccines, the populations that we found in pigs are very diverse. You could not possibly vaccinate a pig using all different Influenza A virus vaccines that are available, so you have to pick and choose. And if then the wrong strain comes to the farm, that is a problem. I was introduced to the P-particle vaccine platform last year by a collaborator. The P-particle vaccine platform is based on norovirus, and the P-particle, which you can see here on top of this slide. This one is the norovirus VLP, and then the second one is the 20-mer P-particle, and that is the P-particle that is used as a vector for expressing proteins, because these loops that you can see here on the surface, they are ideal to express proteins, and you can not only express one protein, but you can express several different proteins in the same vector. So influenza virus is difficult to target because there are so many different types. It has been suggested that the M2E epitope, which is a very short epitope of only 24 amino acids in length, could be used to create a universal vaccine. The reason for that is that it is an integral membrane protein. It is present in low copy numbers in the virus particle, but when you look at infected cells, it becomes abundantly expressed on the surface. And the M2E domains are thought of being highly conserved among different Influenza A virus strains. That means if you have an immunity against that, you potentially could protect against all the different strains, regardless of what strain you are dealing with. The P-particle vaccine platform was tested with the M2E, and here you are seeing data of mice against the M2E. Here, on that first graph here, those are IgG antibodies. That would be P-particle exposing M2E, and here is the free M2E. So there was, of course, a significant difference, and the same was also true for IgG1. An advanced version of the P-particle platform is the complex vaccine platform. The complex vaccine platform uses the same P-particle but makes complexes. And supposedly, if you make complexes, a low immunogenic antigen can turn into a higher order complex that is more immunogenic. When the complex vaccine platform was compared to the regular P-particle vaccine platform, there was a significantly higher immune response in mice against the M2E. Here, that first panel, the blue dots here indicate mice that were vaccinated with the complex platform, and this one is just a regular uncomplexed platform. So you can see there is a significant difference. But these are just antibody levels. In the panel C here on this side, you are seeing a mouse challenge study with a lethal Influenza A virus strain. That is a human Influenza A virus strain that is commonly used in mice. And the characteristic of it is that the mice die that are not protected. So it's a very easy to follow model. You can see here the unvaccinated mice, they died around day 6 and they were all gone, whereas the vaccinated mice in both groups were well protected against the challenge. So the question now is, could that model that has been tried in mice also work for pigs? So the objective of that study was to compare a commercial inactivated pandemic H1N1 vaccine and the 2 novel subunit vaccines that I just explained to you in the growing pig model. Again, we had 5 different groups of pigs. 2 of the groups were vaccinated with either with the particle or with the complex M2E vaccines. Both were vaccinated intranasal. And then, as a comparison, we used a commercial PH1N1 specific vaccine. We were expecting that that vaccine would work perfectly because it was designed for the PH1N challenge. The pigs were challenged at 7 weeks with PH1N1. And then we also used a negative control. For the vaccination, for the intranasal vaccination, we used a mucosal atomization device, and then we also used a special adjuvant. This just gives you another view on the timeline of that study. So we had our 2 intranasal vaccinated groups, our intramuscular commercial vaccine. Vaccines were done 2 times at -28 and -14, and then the challenge was done at day 0, and after 5 days, the necropsy was conducted and the pigs were sacrificed. We collected here every day serum and oral fluid for virus detection. We did NP ELISAs and PH1N1 HI assays. We did not expect any responses against our M2E because the M2E is outside of the NP. But we did see interesting results with the NP ELISA at the time of challenge. In the commercial group where we expected all pigs to be positive, we only found 1 pig positive. That was much better with the PH1N1. And none of the pigs in the other groups seroconverted or had evidence of antibodies. When we looked at viremia nasal shedding levels in this case, that was a little bit disappointing. As you can see, this straight black line symbolizes the commercial vaccine. Our experimental vaccines are on top here, so very similar levels than the positive control. When we look at the lung lesions, again, very similar. Here is our negative control, our positive control, our experimental vaccines. Very similar results to this one. And that's in contrast to the commercial vaccine, which looks very much like the negative control. Overall, the results would tell us that the commercial vaccine worked very good as expected, reduced the lesions and clinical signs in these pigs and also the shedding. However, our intranasal vaccination did not work. So why am I showing you this study here? I am showing you this study because I am learning. I presented that study at a departmental meeting in Roslin, and they told me, oh, it's crystal clear why your study failed. First of all, you used the wrong protein. And I said the wrong protein, but the M2E, it's consistent among all influenza virus strains. And they said, well, this is not true. This is just what people believe. But look at the sequences, and there are huge differences. So I looked at the sequences, and for sure the PH1N1 is completely different to the human, completely different to pig strains. So if you look at strains coming out of pigs, out of humans, out of PH1N1, you find 3 different clusters of M2Es, and that is not, to my knowledge, not public knowledge. So we are right now going back and we are doing Western blotting with our pigs. We are trying to find if we do have antibodies against human M2E, because that would be an indication that we could repeat, and we will repeat, and we probably will express 2 different M2Es, the human one and also the pig one. So in that case, we then would theoretically have protection against human strains and also against pig strains. I was hoping to show you Western blot results today, but unfortunately my +1 became sick last week and could not complete the work, but this is work in progress. Experimental vaccines. So finally, in the last couple of minutes, I just want to introduce you another study that had an unexpected outcome, at least for me and my theories. I was thinking a lot about PEDV, and earlier this year I was in Japan at a meeting where the Japanese vaccine company introduced a vaccine that is given intramuscular, and they say it's really good. It's based on G1. It's really working well against the G2 genotype. The G2 genotype, as you all know, is commonly present in North American pigs, and then in North American pigs you also have the G1B, which is supposedly less pathogenic. So my objective was to just test if we could vaccinate a pig intramuscular with a G1B, and if we would be able to protect the pig against the G2B. I used this experimental design here. So I had two groups that were experimentally vaccinated with a live G1A strain, because you know there is evidence that many people say on farms where you have G1A, G1B, now I'm even getting confused, where you have G1B, you have less clinical disease associated with G2B. So the first 2 groups received G1B live, 1 intramuscular, 1 orally, like we always expose. The third group received a G2B intramuscular commercial vaccine, and then we had a positive control that was not vaccinated and a negative control that was vaccinated. The pigs were challenged 4 weeks after vaccination orally with G2B. Here we are looking at IgG antibody levels over time. As you can see here, the commercial vaccine, as expected, had very nice IgG antibodies in serum, already developing 2 weeks after vaccination, and then very high levels, significantly higher than all other pigs. Our oral G1B group also had IgG levels detectable starting with 2 weeks after vaccination. Not as high as the commercial one, but that is sort of expected because we checked his serum levels and that group was vaccinated orally. Then we also checked for IgA response, and here we had a very nice response with the G1B, with the live vaccine, not as good with the commercial vaccine. We also checked fecal IgA, and again we had very high levels with the oral vaccinated 1B group, but not with the other groups. When we looked at our viral shedding after challenge, we did see something unexpected to me. This here is the area of virus shedding for the commercial vaccine, so rather low shedding, and that's what we would expect if a vaccine works. The green one would be the intramuscular, which did not work. We did never see any seroconversion with that virus, so just vaccinating a pig intramuscular does not work. But I was really hoping that the oral administration of one G1B would work just nicely, because we would give the pig a live virus. It has a nice enteric immunity, so it should be protected, in my opinion. It had a very good, these pigs had a very good IgA response in serum and in intestine. However, these pigs were similar to the positive control, because they correspond to the black line here, so very high level of shedding. So they were not protected at all against the G2B. That's about all I want to say about that, because I have no explanation for that, why we could have all these nice antibody responses and having an ideal scenario for a vaccine, and a live strain putting on the right position where it should protect, and it is not working. So to me that means there is maybe very limited cross protection between these strains. But I know that is very controversial and in contrast to what others say.